Hi, I'm Steven with JB Dental Lab here in Tempe, Arizona, and we're a fully digital all-on-X dental lab. Today we're going to walk you through the steps for how you can implement this in your practice as well. When it comes to digital full arch dentistry, it's all about the records. And so we're going to go over pre-op records as well as day of surgery records to see what the designers look for and what you should be looking for with your team when you take these records. The first type of records we're going to go over are edentulous patient records at stage 0, which is our treatment planning phase. First thing we do is to evaluate the bite with their dentures. Evaluate if the vertical dimension that they're set at in this denture is correct. If it needs to be opened or closed, we need to do that physically. Once we have a bite set, you're going to take a light body wash impression using the denture as your tray. You'll put it back in the mouth and let it set up. It's important while this is setting up that you have the patient biting and that you're making sure the midline is still correct and that we haven't inadvertently opened the bite with the PVS material. Once this is set up, you'll take the denture out of the mouth and scan it 360 degrees in your hand using your intraoral scanner. Start with the intaglio, then work your way up the flanges and roll over to capture the buccal and occlusal surfaces of the denture teeth. Once this scan is completed, you'll put the denture back in the mouth with the wash impression, and it's time to take full face photos from the portrait and the profile. We want to see the patient with a relaxed lip, a natural smile, and an exaggerated smile. And please provide any details of changes or smile designs that the patient has. We'll go over and look at these photos in a later slide. Now we'll talk about dentate patient records during the treatment planning phase. Just like with dentures, we're going to evaluate the patient's bite and open it if necessary. Some of the methods to do this would be by building composite on the posterior teeth, using putty or leaf gauges, or a bite rim if necessary. Take full coverage scans of the upper and lower jaws. On the upper, it's important to capture palatal tissue, buccal vestibular tissue, and distal extensions as far as you can if patient is missing molars. On the lower, it's important to capture distal extensions if they are missing molars, as well as buccal and vestibular tissue. Next, you'll take the bite scan. If you've opened them to an increased vertical, please take this scan at the opened desired vertical. Next, you'll take full face photos from the profile and portrait with a relaxed lip, natural smile, and exaggerated smile. Take a 3D face scan if you have it as well, and give us any details necessary for the smile design. Here are some examples of photos that we'll use to aid us in our design. Please note that the camera is at the same level as the patient's face. Also, it's important that we can see the patient's eyes and ears. So if the patient has long hair, make sure they tuck it back behind their ears. Now that we have all of our pre-op records, we will start aligning and creating a digital replica of this patient. Here you can see a CT scan overlaid with a facial scan overlaid with intraoral scans. Once we've had our digital patient created, our designers will go ahead and set teeth in a desired position. Now that we have our teeth set in the proper place, our designers can send you tools such as these surgical reduction and multi-unit placement guides to print out and be ready the day of surgery. Okay, now we've reached the day of surgery. And the first thing that we need to do once the patient is numbed is determine what our breadcrumbs will be. Breadcrumbs are markers that the designers will use to relay post-operative soft tissue intraoral scans into the correct preoperative vertical that we set in our treatment planning phase. There are two main types of breadcrumbs. They can be existing teeth that we leave until the end of surgery, as can be seen on the right where 2 molars are left, or they can be markers placed into the palate or the retromolar area on the lower. On the left-hand side, you can see 2 markers placed into the palate of the above patient that we have been building a digital profile for. Once these markers are in, or we've determined that we're going to leave molars till the end of surgery, We can take full coverage impressions, and we need to focus these scans on the palate and the teeth. So on the left-hand side, we're grabbing a good scan of the breadcrumbs and the teeth. Once these scans are completed, you'll send them to your designer and allow them a minute or two to make sure that the two intraoral scan meshes align properly. Now that we've completed surgery and now all of our implants are in position, we need to check that we have our final torque level on all of the multi-unit abutments. There's two things left to do. We need to take our ICAM or PIC measurement, and we need to get a post-op soft tissue impression or scan of an impression with the healing caps in place. Here are two examples of scans of impressions post-op with healing caps in place. You can also see, please note on the left-hand side, you can see the markers on the palate are still in place. Once you have these, send them to your designer and allow your designer a few minutes to make sure that the post-op soft tissue impressions match up with the pre-op scans with the breadcrumbs. Now that the designer has all of the necessary scans and implant information, we can start the design. Here's a good example of what all of these pieces put together look like. Starting in the top left corner, we have an overlay of our design and our tooth position that we laid out in our treatment planning phase. On the post-op soft tissue scan, giving us intaglio information. Right below that, you can see the green circles. Those are the measurements taken from the ICAM or PIC scan that give us implant position. We're then able to overlay that, if you look at the image in the lower right-hand corner, back into the soft tissue. Once we have all of those pieces together, we can finalize our design and have the design attached directly to the multi-unit abutments, and you'll have a design ready to print. Once you've downloaded the design from your designers, you'll load it onto your 3D printer, and when it's done printing, you'll light cure it and characterize it, and it'll be ready to load into the patient's mouth. Here you can see our patient being loaded with the immediate printed surgical designs. Just to go over these records again, here's a streamlined look at what all of these images will look like on the day of surgery. Number one is our breadcrumb scan. This is our scan with all of the patient's existing teeth and soft tissue in place with our markers in the palate. Number two is our post-op white cap scan. Here you can see the markers are still in the palate, and we have our multi-units in place with white cap healing caps on the multi-units. Number three, you can see that our designers have taken the two meshes and aligned them into the correct position. And in the last image on number four, you can see how we've taken the PIC or ICAM scan and put it back into the soft tissue to give us implant positioning. Now here you can see that our designers have taken all of that imaging and finalized our design and prepared an STL file that fits directly to multi-unit abutment and sent it back to the doctor to print. Thanks for watching. I hope you learned a lot, and feel free to reach out to us if you want more information.